So this lifestyle program that we're kind of initiating tonight begins with lifestyle changes that incorporate better habits of health. Now, it's not just a kind of willy-nilly, kind of rah-rah. It's a structured process of lifestyle changes that have been scientifically verified. The program that we're going to be talking to you about is called Therapeutic Lifestyle Change, and it's actually been tested in 9 different university studies and shown to help people lose weight, control their cholesterol, reduce their blood pressure, reduce levels of inflammation in the body. And so to help me kind of explain to you a little bit about that, I'm going to welcome up here our nurse educator, lifestyle educator, Michelle Swift. Okay.
Hello.
Michelle, where'd you just get back from?
I went to Boston at the end of February.
Okay.
For about 3.5 days.
For a certification program in?
First line therapy or therapeutic lifestyle change.
Okay. Was there quite a few people there?
There were about 175 health professionals, everything from, I was one of 3 nurses there. There were chiropractors, physical therapists, dietitians, personal trainers, nutritionists.
Any MDs?
Few MDs.
Few MDs.
Few naturopathic
doctors.
doctors.
Are starting to get into it, yeah.
Yeah,
okay.
A few.
Yeah, well, what kind of stuff did you study about there?
Oh gosh, we talked all about proper nutrition and the ways that it really affects every single cell in your body. What goes in your mouth food-wise really has the potential to genetically change your life. And so we talked about that. We talked about different ways to get exercise and how to encourage people with proper exercise, stress management, sleep and relaxation techniques.
Well, I'm sure, I think these are all things that people have heard about, but are these specific programs to help people really learn new lifestyle habits?
Right. A lot of different programs are not very individualized, it seems, where this is targeted directly at each individual person. It's unique. It'll be different for every single person. The reasons why they're doing it, the labs that we get back on that person, we are able to target specific things with each person. Everybody would have a different health plan, food plan, exercise regimen, those kinds of things.
Do you do any objective testing along the way to make sure people are actually making progress?
Yes, we track the whole program. Each step of the way, we're looking at things like bioimpedance analysis or body composition of people. We're looking at their weight. We're looking at lab work, changes in lab work over time. We're looking at
You're also following the symptoms.
the symptoms and how a person is actually feeling. Whether we're seeing improvement, if we need to make revisions in certain areas, and just to really target what they need.
So this is not just like a protein powder diet or some
No.
kind of gimmicky...
There is some protein powder involved. There's also some meal bars that are involved, but they are not meant to replace a meal. They are meant to be kind of like a supplement that you would take, just like a fish oil would be a supplement. Vitamin C would be a supplement. You actually get to eat with this food plan, which is different from a lot of diets. I actually don't even like to use the word diet because there's nothing diet about it. It's just a way of living.
Well, we all know that diet is a 4-letter word anyway.
Yes, so it's a naughty word. So I don't really like to use it, but it's a food plan. It's actually a way of living. What we would discuss is when to eat and what to eat during the day, how often to eat. That's one thing I personally like about the plan is I get to eat. I can snack, and I am a snacker, so that actually works out well. Eating is actually encouraged, so.
So we're actually helping people learn how to make better choices. We're monitoring their progress.
Right.
We're giving them a structured program that will help them increase the probability of success
Exactly.
if they invest in their choices.
Right. It's set up with a lot of structure and a lot of guidance and counseling. So it's not just me turning you loose and saying, here, you need to exercise, go do this. there's actual accountability involved and structure.
So is this why it's called therapeutic lifestyle changes?
That's
It's
precisely why.
therapeutic,
Yes.
and it's lifestyle, and you're actually making changes for the better.
Right, exactly.
Okay, excellent. And Michelle's going to be in the other room here afterwards for you to come in and ask specific questions too if you've got more questions. So,
Right.
Michelle, thank you very
You're
much.
welcome.
Good
Thank
job.
you.
Okay, so that's one aspect of the lifestyle medicine. Now we're going to jump back to chronic illness care. You know, most Americans, I mean, it's really hard to find someone that doesn't have some kind of a chronic illness, whether it's chronic fatigue, chronic depression, chronic joint pains. Obviously, cancer seems to be on the rise. This year, they're expecting the cause of death in the United States to be, the number one cause is going to be cancer. It's overtaking heart disease. Certainly diabetes is on the rise. And so all of these things become burdens to people. And people are looking for ways to find what's causing it and what they can do to get more help. And unfortunately, as the doctor's offices get crowded and the symptom control medicines multiply, people begin to feel bogged down by their chronic illness. And so what we've tried to develop here over the last 34 years is a way for people to come in and be more involved in the discovery process, the discovery of finding out what they need to do to actually begin to get well. And so to kind of help me talk a little bit about that process, I'm going to welcome up here our Director of Clinical Operations, Dr. Rebecca Kirby. Yeah. Welcome.
Howdy.
Where do you think she's from with that?
Howdy.
She's our Texan.
Yeah.
All right. So what's your educational background, Dr. Kirby?
Well, my educational background is that I'm a board-certified family physician, and I'm also a dietitian that specializes in integrative and nutritional medicine, which is what we do here at the center. In fact, the Domes for the last 30 plus years have been the Midwest specialist in integrative and nutritional medicine. And what we have been doing is taking care of people who have not had their health issues solved through traditional avenues.
Yeah. And what do you like the best about working? You've been here how many years now?
I've been here 7 years.
And so how has this differed from your traditional family practice?
Oh, when you come in as a patient here, we spend an hour talking with you because you've been to see many doctors perhaps already. You have issues that have not been solved. So our mission is to get to the bottom of it. And something I want to point out that's very unique is our approach to you as the patient, recognizing your uniqueness, because we all look different, obviously, but even on the molecular level, we are all different. And that's why we are different in how we manifest illness. So when we get to the bottom of it, we're looking at everybody's biochemical individuality. And part of that is measuring how you use, digest, absorb, and access the nutrients in your diet. And that's part of our approach as we try to find the cause of why you're not feeling well.
Yeah. Did you have very many hours of nutrition in medical school? I didn't have that many. I didn't know if you did.
Well, I went to medical school late in life because I had already been in nutrition and biochemical research for a decade or so before. So luckily I had a nutrition background, but guess what? In medical school, we had an hour lecture at the end of the biochemistry course when everybody was so busy, studying for their biochemistry finals that was the class that they were most likely to skip. And that was not that long ago. Yeah, so yes, no, there's not much nutrition in medical school, but you guys all know.
Okay. Well, thank you very much.
You're welcome. Welcome, everybody.
Yeah.